Hey, hello everybody. So I thought I'd share, a long time ago I hurt my back very badly and I have a herniated disc in my L4, L5. And then I also have what they call a sprained thoracic. It's another bulge uh, in the upper area of the back. So this is kind of the routine I put together for myself to get myself better, and this is how I manage day to day. And I find if I don't do this, my pain level increases, and if I stick to this routine, it actually helps with pain levels. So having a good fit core can help with the back problem. So I'm going to show you, I'm going to do 2 quick rotations, and I think if you did 2 of these rotations in the morning, maybe 2 in the afternoon and 2 in the evening, and you do that about 3 times a week, you're going to be, doing a lot better over time. So let's get to it. We'll do a side leg lift. I like to do 25 of these. I did 30 crunches. You feel any sort of a pain in this or popping in your hip, you should rotate forward or backward to find the right spot. There shouldn't be any sort of resistance here.
Papa, I want pancakes. I want pancakes.
Okay, let's make pancakes. Okay, we're going to stop the video and make pancakes. We'll be right back. Alright, there we go. Pancakes made for the little baby. It's a good illustration of, sometimes your workout's going to get interrupted, and don't let that stop you. So if I remember correctly, I did this side, so we'll roll over and we'll do this side. And it's really better if you're, let's say, wearing shoes or ankle weights. After a while, even 25 is going to be not enough. This side is especially hard. This is the leg that had most of the radiating pain all the way down to the toes. So especially right in here, it's going to be a good workout. So next step, I like to do Supermans. I found that's about the only back exercise I can really do that doesn't actually cause pain. You can actually, when I flex my stomach muscles right in here, it just cracks and makes the most unusual feeling.
Why there's no space? Why there's no space? Why there's no space, Papa?
I don't know, there's no space. Alright, and then what I mean by 2 rotations is you start over and do it all over again. It's better if you're doing it back to back. We'll go over to the side again.
I want to go to sleep.
Okay, got it. Alright, everybody. This is a beautiful illustration. So put the baby down for a nap. She's not feeling well. And so I'm going to start over again, you know? If I have to do the same set of crunches 5-10 times because you get interrupted, then that's what you have to do. You know, if you want to stay fit and fit it into your life, then do what you got to do. So we're going to start over again. So this is not the ideal way to do it. I like to do my rotations back to back, but you know, it's better to do something than nothing. So it's starting to feel a little bit weird if I go too far back. It's uncomfortable for the hip joint, so don't do that. Bring it forward a little bit. Do some Supermans. Oh man, that cracks. And sometimes, if everything's tight, you can bring it up and hold it in a nice stretch. Go back. Okay. So another point I want to make for everybody is I'm not a doctor. I'm not a physical therapist. During the course of my injury on my back, I had several physical therapy sessions and ran exercises back and forth with doctors and physical therapists, told them what I'm doing. Here's my routine, is it okay? So before you do anything you see that I do, you need to run it by a physician and potentially a physical therapist. I don't want anybody to get hurt, but I do want people to go out there and do something. Go do something good for yourself and start a fitness regimen. And you know, doing this channel here helps me keep on it. You know, anytime you start to feel that your dedication is waning, then find something to change it up and make it exciting, and keep at it. Thank you very much. So I like to do 2 rotations of that, which should take less than 10 minutes if you're doing it. So we're doing sets of crunches, whatever you can do. When I started out, it was probably 10 or 15 crunches because I was in a tremendous amount of pain recovering from the herniated disc. And the side leg lifts, I think I started with 10 probably, again, because I was right in the middle of a massive amount of pain. So do what you can, do a routine, stick to it. I would say you need to do these core exercises at least 3 times a week, like Tuesday, Thursdays, and Sundays are the days I like to do them. So thank you very much for tuning in. Bye.